we shall now continue with agenda item 5H, implementation of the regional framework for the surveillance and control of invasive mosquito vectors and re-emerging vector-borne diseases, 2014-2020. Lessons learned and the way forward. The relevant documents are Euro/RC68/16. The WHO European region has experienced an increase in the spread of the invasive mosquitoes since the 1990s. Aedes albopictus and Aedes aegypti, which are effective vectors of potentially severe diseases such as dengue, chikungunya fever, and Zika, have recently spread across parts of the region. In order to respond to this threat, we adopted at the Regional Committee 63rd session, the Regional Framework for Surveillance and Control of Invasive Mosquito Vectors and Re-emerging Vector-borne Diseases for 2014-2020. It intended to guide us in the development or updating of our own operational plans, of harmonization of plans and approaches between countries, cross-border action. Along with dengue and chikungunya, which are addressed in the regional framework, other emerging vector-borne diseases such as West Nile fever, Zika, and Lyme borreliosis are also causes for concern, and their public health importance should not be underestimated. We will now review progress and main challenges faced by Member States and WHO in implementation of the regional framework, as well as further steps required to accelerate implementation of the regional framework will be discussed. The Standing Committee recognized the importance of this topic and set up a subgroup of vector control chaired by Dr. Vasconcelos. We welcoming the strategic approach for integrated global vector control considered as a next step the following three options: developing in accordance with the World Health Assembly Resolution WHA 70.16, a regional plan on vector control. Second, expanding the scope of existing regional framework for surveillance and control of invasive mosquito vectors and re-emerging vector-borne diseases 2014-2020 to include other vector-borne diseases of concern. And third, accelerate implementation of the regional framework for surveillance and control of invasive mosquito vectors and re-emerging vector-borne diseases for 2014-2020 and address other vector-borne diseases of concern on the basis of disease-specific and sub-regional approach. We concluded with the proposal to further accelerate the implementation of the existing regional framework and consider expanding the scope of include other vector-borne diseases of concern as needed: West Nile fever, Lyme borreliosis, Zika, and tick-borne encephalitis. I will now give the floor to Dr. Nedret Emiroglu, Director for Emergencies and Communicable Diseases, Euro, to further introduce the topic. Please, Nedret.
Thank you very much, Executive President, and good morning. It's a pleasure to give you an update on the implementation of the regional framework, which is becoming more and more critical and important in the region as we see the Aedes mosquito species increasing transmission in the region, and also in addition increasing vector-borne diseases. As just a reminder, as the chair was summarizing, you approved the regional framework and it has been implemented, unfortunately with very limited resources since 2014. And I'm grateful to a number of countries who has been crucial in helping the Secretariat, like Netherlands, Greece, France, Italy, who has been recognizing the importance of increasing vector-borne diseases in the region. So the framework was focusing on 2 vectors, and actually 2 vector-borne diseases, dengue and chikungunya. But then the situation has been changing. We had the Zika as one of the threats. And now a big concern this summer is the increasing number and an early season for the West Nile virus. We have more than 1,400 cases so far reported to ECDC and WHO from 11 countries. So this is of concern on the overall growing scale, particularly in the southern part of the region. So I will ask my colleague, Dr. Masoud Dara, who is the coordinator in communicable diseases, to give you an overview of what is the epidemiology, how we implemented the regional framework, what are the lessons learned, and what are the next steps that is being proposed. Before that, let me take this opportunity to thank the subgroup on vector-borne diseases of the Standing Committee of the Regional Committee, particularly Mr. Baskauzos, for the great guidance and support they provided. But also this has been, again, a pure partnership, very strong collaboration with the European CDC, as well as the European Mosquito Control Association and VectorNet, which we are grateful, and we would like to continue to work together. So, Masoud, to you.
So thank you very much, Nadjet. Good morning, dear colleagues. Before starting presentation, I would like to also acknowledge my colleague, Dr. Elhan Kasimov, who's provided slides to help us, and also as well as our colleagues from headquarters, Dr. Raman, who has been here with us. He's coordinator for vector-borne diseases in headquarters. So what we see here, this is numbers and actually reference to ECDC. As Nadjet mentioned, the data are collected from various countries. As you can see, both dengue and chikungunya, we have the numbers variation between different years. And the point, of course, is that this is only the tip of iceberg. The reason we are saying is that, as you know, almost 80% of all the cases are asymptomatic. So the cases are asymptomatic, but also have the virus. They can already be a reservoir where you can also have more cases. So that actually calls for doing more work to address these 2 vector-borne diseases. Nadjet already gave you the update. This update come again. Thank you for European CDC for the great input that they are doing for the collection of the data that we have for West Nile. Another difference, of course, as you know, the mortality is much higher. Both case fatality and the mortality of the West Nile. And there have been 64 deaths reported so far. These numbers may also increase. So the other thing is also the vector that we have is already existing in many countries across Europe. And that's also another alarm bell for us to make sure that we are aware of the situation and have it under control. This also shows basically where we are in terms of vectors that are re-emerging in our region, both the Aegypti as well as Albopictus. As you can see, it's been established, particularly the tiger mosquito on the right side, on your right side, in many, many countries. But also, as you can see, we have gray areas. So there are data we do not have from many, many countries. And that's actually extremely important to make sure we do have a very good surveillance in place. You recall, of course, the Zika, where in 2016 was a major news item and also very much concern from global level. And that was an opportunity to send a survey. I know our regional director does not like us to send too many requests and surveys to member states. We always try to follow. But we did this one because of the importance that we have in that moment. And actually, this one is giving very good, rich information that 40 countries have no surveillance in terms of the entomological surveillance in place. That's and also another area that we need to further work. But also clinical surveillance, symptomatic surveillance. Now, in terms of what are the areas, what are activities that have been implemented, we've been working with various countries in terms of capacity building, both in terms of training, but also following mentorship. There have been a series of training courses being organized in Croatia, Armenia, on mosquito identification and also capacity building in terms of how to identify the disease. There have been from Tbilisi as well as some training being organized as well as the Tajikistan, Dushanbe. And a manual has been drafted, which is going to be finalized this year in terms of prevention of establishment of vector control. Communication. Communication, extremely important elements. We also know most of the countries who are affected, they also have strong tourism. So you do not like to have the wrong messages going to public, but also on the other hand, you also want to communicate with your communities how to control vectors, avoiding waters that are staying for a long time on places, how to stop the breeding of mosquitoes. So the campaign has been also going on in several countries, and we are happy, of course, to share more information on the guidance that our regional office is providing. Now, what are the lessons learned and the way forward? We really need to see the strong political commitment. The numbers may not seem high, but we should be very, very aware that if you not address the vector-borne diseases, there's a high risk of having it widespread outbreaks. And this commitment should be also followed with adequate human and financial resources. Very strong surveillance system should be in place. And again, thanks to the great work that is done by ECDC, we're happy to expand our collaboration on that areas to make sure get the data, right data from the countries. Very important, vigilance is very important for your healthcare workers to know the symptoms that are assumptive of the disease and how to take and report on that one. Also intersectoral one is very, very important. We should make sure that you get the other sectors, agriculture, as well as also other areas that needs to be addressed on board through the SDG approach. That could be a very, very important approach. Communities need to be mobilized, but also very important cross-border. If there are cases to be reported, to be also discussed among the countries. Now, as Nedret mentioned, and as well as the chair, this was already discussed at our SCRC, and there were several proposals, and one of them that was put forward is that how regional committee is going to advise us how to go to the next step of strengthening implementation of the regional framework, or even addressing the other vector-borne diseases which were not in the framework. Thank you very much for your attention.
Thank you. The presenters. Now I'd like to invite Dr. Vasconcelos, our Deputy Executive President, in his capacity as a chair of the SCRC subgroup on this important topic, to take the floor.
Thank you, Mr. President. Colleagues, thank you, Nedret, thank you, Masoud. I'm happy that the subgroup moved things forward. Now is the time for the framework to be activated as much as possible and proceed. We face the risk of local transmission and emergence of vector-borne diseases in receptive areas. It is obvious that climate change is going to affect all of us and will put increasing pressure in health systems and public health authorities in our region. We should be prepared to rapidly contain outbreaks of vector-borne diseases at an early stage. Aedes albopictus is well established in southern Europe, including Greece. This mosquito has transmitted chikungunya and dengue virus locally and led to recent outbreaks in southern European countries, Italy, France. We do not know if and in what degree the Asian tiger mosquito can also transmit Zika, yellow fever, or West Nile virus. At the same time, there is a risk of Aedes aegypti reintroduction in Europe. We should be ready to identify and contain any new invasive species after its reintroduction at points of entry before its reestablishment. West Nile virus has been established in many countries in South and Central Europe and is considered now endemic with seasonal occurrence in cases. In 2018, early circulation of the virus and large number of cases has been recorded in Italy, Serbia, Greece, and other countries. Recently, in Greece, we have faced the risk of vivax malaria introduction in vulnerable and receptive areas, indicating that risk factors do still exist for the reemergence of eliminated diseases. So what we can do, as mosquitoes will continue to exist, as well as the risk factors for the emergence or reemergence of vector-borne diseases, given the increase of the population movements and travels worldwide. Firstly, and most importantly, we need to strengthen and build capacity in our own public health systems. Human resources capacity should be urgently and sustainably enhanced. Epidemiologists, medical entomologists, public health professionals at the national and local level should be recruited and trained to be able to respond to these emerging health threats. At the national level, it is imperative to continuously develop, update, and implement national preparedness and response plans for these agents. Financial and human resources availability poses a challenge to many countries in our region. Political commitment at the highest level and advocacy is needed to ensure funding and capacity building in the long term. The main vertical prevention activities include early detection of cases, enhanced surveillance. We know our surveillance systems only catches the tip of the iceberg of vector-borne disease cases, as many of them are asymptomatic or mild. So, clinicians should keep heightened awareness for these diseases, and the laboratory capacity should be supported to ensure diagnosis. Effective and sustainable vector surveillance and control. The revision of the regional manual on vector control is very much appreciated and welcomed. For once more, human and infrastructural capacity should be urgently enhanced for implementing integrated vector control and surveillance at the regional and local level. Vector control activities should be supported by the proper legislation and regulatory and organizational aspects to ensure the availability and proper use of effective biocides and to also minimize the emergence of resistance. We need more tools to fight mosquitoes. We need research to select the proper tools, and we need European legislation to have these tools available at the market and be able to use them systematically and for public health emergencies. We should open the discussion on the risks and the need for effective response with other involved stakeholders, such as environmental agencies. In addition, additional research is needed to understand the epidemiology of these pathogens, to identify predictive indicators which trigger outbreaks, and to identify the effectiveness of vector control methods. We should invest on capacity and expertise building on vector management and control. Communication campaigns for mobilizing the community and raising public awareness for the reduction of mosquito surges and of human vector contact. Travelers' health and proper advice should also be addressed for their own well-being and for minimizing the risk of importation of vector-borne diseases. Clear national legislation to cover coordination and distribution of responsibilities of all involved stakeholders is necessary. The dedicated Committee for Europe subgroup on vector control is very much appreciated and expected to address the main challenges and suggest possible solutions with regard to the implementation of the regional framework. Let me finish by saying, we still don't know many things. We need to act urgently. We cannot continue with business as usual. Thank you very much.
Thank you very much, Dr. Vasconcelos. Ladies and gentlemen, I now open the debate and I request delegates wishing to speak to raise their nameplates, please. We are starting with Monaco, followed by Russian Federation.
Merci, Monsieur le Président.
Thank you, Chair.
Ladies and gentlemen, we'd like to begin by thanking the Secretariat for having presented this report to us. Vector-borne diseases are a major public health challenge. They're a challenge for our public health systems because there are potentially very high death rates. But they're also an opportunity for us because we can act on the causes of vector implementation, things like climate change. And as is emphasized, climate change could indeed have a significant impact on the transmission of vector-borne diseases. Monaco in the Mediterranean has, of course, been affected by the so-called tiger mosquito, the Aedes aegypti, in recent times. We are aware of the threat that this presents to public health, and therefore we have developed a national strategy. There are 4 points within that. That is to say, getting rid of mosquitoes using an insecticide that is environmentally friendly. Secondly, making health professionals aware of the issues by having various campaigns about mosquitoes and giving recommendations so that people can identify the symptoms of viral diseases and can easily identify vector-borne diseases. Thirdly, monitoring things like Zika, chikungunya, and other vector-borne diseases such as West Nile fever, all of which must be declared to the Monegasque authorities. And fourthly, cooperating, particularly through a bilateral agreement with neighbouring France, again on destroying mosquitoes when those that bear diseases such as dengue, chikungunya, or Zika are identified. We are then working at the highest level in our principality in seeking to do something about this. And malaria control is one of our flagship programs and something we're very much committed to. We provide funding to WHO. We also provide funding for the high adventure countries, and we support the most affected areas in the world. Thank you.
The delegates of Russian Federation, followed by Spain. Please.
Большое спасибо.
Thank you very much indeed, Chair. The Russian delegation has studied this document in detail, and the document rightly points out that in a number of European regions we have seen an acceleration of problems relating to vector-borne diseases, particularly those borne by the Aedes aegypti. And we see that things like dengue, yellow fever, chikungunya, Zika have become an emerging problem for us. We have various types of mosquitoes in Russia, particularly in the southern part of our country and close to the Black Sea. However, as is rightly pointed out in the document, we do need to extend the range of pathogens that we monitor, and we need to look in more detail at the way in which these diseases can be transmitted from one area to another. And things like West Nile fever or hemorrhagic fever are also diseases that have re-emerged recently. We therefore recognise that we have to identify the active agents, and this allows us to expand the scope of what we do. And indeed, a number of countries that do not at present think that they are greatly affected in the front line by mosquitoes are nonetheless going to be affected in future. And these are countries where there's considerable expertise and knowledge that can be shared with others throughout the whole European region, because we are all together trying to tackle this problem. A number of recommendations are put forward here in order to allow us to achieve the programme aims that have been set for the European region in the near future. But alongside all of that, we have to expand the range of fundamental research that we do in this area. We think that's very important. Especially, we have to look at the dissemination of vectors carrying various pathogens. We have to identify the properties of those pathogens. We all need to do that in order also appropriately to carry out environmental monitoring. We need to look at biological and chemical products and pesticides that may be used, and we need to ensure that we're using the right things to combat the vectors that we have. We need to model the kind of approaches that are taken and ensure that they can be ruled out on a broader basis. This means that we need to have multi-sectoral cooperation, and especially we need to work through the laboratory networks that we have. The Russian Federation recently has made a significant contribution to bolstering its laboratory infrastructure both within the country and beyond. All of the work that is being done by the Russian Federation is very much supported by our interdepartmental targeted approach, particularly focusing on biological and chemical safety issues. In the light of all of that, we support what is stated in this report, and we're willing to contribute to implementation of this programme, especially studies into risk analysis and looking at appropriate technological and other resources that could be used to combat this issue. And we are certainly willing to assist in training and sharing expertise on this issue. Thank you.
The delegate of Spain, please, you have the floor.
Thank you, Mr. President, Regional Director, dear delegates. Spain welcomes the report on implementation of this regional framework and acknowledges the progress made on surveillance and control of mosquito vectors and vector-borne diseases. As we had already communicated, in 2016, our country diagnosed for the first time 2 autochthonous cases of Crimean Congo hemorrhagic fever, and this summer, we diagnosed a 3rd case. Although this disease is in Spain producing only sporadic cases, it is endemic or expanding in several other countries in the region. We therefore agree with the SCRC about expanding the scope of the regional framework and welcome the proposed inclusion of tick-borne diseases, such as tick-borne encephalitis, in the plan. In this context, we would like, however, request the Secretariat to consider including Crimea Congo hemorrhagic fever as well to be part of this expanding scope. Thank you very much for your attention.
Thank you, Spain. I would like to ask delegate of Italy to have the floor, please.
Thank you, Mr. President. We thank very much the WHO for the report on the implementation of the regional framework. And at the same time, we will point out the interconnection of this topic and of the related initiatives with many other areas of work of WHO and of this regional committee. First of all, it's clear the connection between the climate change and the insurgence of vector-borne disease in geographical areas where they were previously absent. Secondly, the vector-borne disease are certainly facilitated by transport of goods and from the establishment of reservoirs in EU countries, region countries. This situation requires a strict vigilance by health authorities and professionals. And so, together with our thanks to WHO for working on this topic, we invited the regional director to ensure the implementation of the framework already in place with stressing the information and specific tools for training of health professionals on disease not well known to them, and with efforts to ensure a One Health approach and collaboration with the animal health authorities and technical services, and support to national entomological services in their laboratory and on-the-field activities, helping to create an adequate number of trained experts. Finally, to contribute to create a network and networking activities aimed to facilitate the exchange of data and best practice between countries. Thank you very much.
Thank you, Italy. As I don't see any other requests from the member states, then with your permission, I will ask non-state actors, International Federation of Medical Students Association, please, you have the floor.
Honorable chairs, distinguished delegates, the IFMSA congratulates the ongoing work of the regional office to strengthen capacities and provide technical assistance to member states on this issue, despite limited resources. Recent increases in the introduction and establishment of invasive mosquitoes, accompanied by dramatically growing incidents of dengue, chikungunya, and Zika, raise substantial concerns. The IFMSA recognizes that combating vector-borne diseases is likely to face additional challenges in the coming years due to international travel, habitat changes, climate change, and increased human mobility. To identify high-risk situations and create prediction models, it is essential to acquire knowledge on host preferences, relevant breeding places, vector competence, and climate drivers under European conditions. Yet, data on vector-borne diseases provided by many member states to the World Health Organization are not accurate, and submissions not regular, hampering epidemiological understanding. Furthermore, We want to underscore the connectiveness and interdependence of animal, human, and environmental health, illustrated by vector-borne diseases. This demands a paradigm shift to the One Health strategy, currently unmentioned in the regional framework. Therefore, to achieve the regional goal, we urge member states and all stakeholders to, first of all, make strong political commitments supported by human and financial resources to implement appropriate disease and factor surveillance and prediction systems at the national and subnational level. Secondly, to ensure accurate and regular data submissions to the World Health Organization. And lastly, to strengthen intersectional and intersectorial collaboration whilst taking accountability for integrating programs, policies, legislation and research in which multiple sectors communicate and collaborate, taking the One Health approach in mind. This framework gives us the desired direction, a path to follow. Yet, only with strong political will, community engagement and mobilization, we will be able to build resilience.
Thank you. Now I ask Dr. Emiroglu and Dr. Dara to respond to the comments and questions.
Thank you very much, President, and thanks to member states and the civil society who has been taking the floor on providing your comments as well as your support to the proposal by the Secretariat on the way forward. Just a few points that I want to kind of underline is you recognize the increasing number of cases, the broadened nature of vector-borne diseases, and increasing number of countries affected. And I want to quote Monaco, which I totally agree with you that it's also an opportunity. Linking it to the climate change is going to be a good opportunity in being engaged within the global strategy, and at the same time shows the importance of intersectorial action to be able to combat these diseases. Two areas are critically important, as you raised. One is the issue on the vector control, which has been sort of neglected area with very limited, actually, human resources as well as financial resources in the region because it has been considered as a disease in the past, and also increased attention on the surveillance of the disease with a broader aspect of looking into all vector-borne diseases. So you asked for data exchange. We'll be happy to do that, sharing the experiences. And of course, the most important focus that WHO is going to be providing is coordinating and collaborating with the countries so that there will be some cross-border also, as Monaco mentioned, cross-border actions within the region, but also we would like to expand it to the Eastern Mediterranean region countries as well so that we could cover the whole epidemiological block. And you also ask for increased research, including the operational research. And Spain was also mentioning of broadening to be able to also include the Crimean Congo hemorrhagic fever, which we welcome all. But a quick plea and request is that the Secretariat is in a very difficult situation in being able to meet all these demands with the currently available resources. So we are really looking into some increasing resources to be able to support you, which is going to be matching with the increasing demand. And I very much thank you in advance for your support. Thank you.
Thank you very much, Dr. Emiroglu. This closes our deliberation of this agenda item. And also, this concludes our work for this morning.